Welcome to Washington Unplugged. The debate over health care reform is moving out of Washington, out into the country as members of the House and Senate face their constituents. Marc Ambinder is CBS News chief political consultant and spoke with several administration officials about how the president is going to try and shape that debate. Marc, what are they going to do?
Well, they're going to try to do several things, one of which is they're going to try to create an enemy. Creating an enemy concentrates the mind on choices, and the enemy that the White House has chosen is the insurance industry. Which is a little ironic because they've been working with the insurance companies for the past 5 or 6 months, and the insurance companies have made a lot of concessions toward the cause of reform. But that insurance companies remain very unpopular. That's one reason why the president 2 weeks ago started calling this health insurance reform versus health care reform. The idea is you create an enemy, insurance industry, you link them to the Republicans, so you have a good guy versus bad guy scenario, and you rally the base, and then you try to rally the American people around the concept that reform is necessary, and these other guys are forces of status quo and trying to obstruct reform.
And this is a tonal shift because
Right.
so far the president has been working in this kind of let's all reason together. So this is a little bit more hardball. Why are they having to play hardball? What's gone wrong?
Well, they're having to play hardball because they don't yet have a bill. They don't have an agreement on about 20% of what they want, and it happens to be the hardest 20%, which is how do you pay for everything. And they have to get the Democratic base more enthusiastic about health care. They have to get the Democratic base involved in this debate because that'll put pressure on wavering members of Congress, blue dogs in the House, members of the Senate as well. But they also think that if the American people in the aggregate take a broader view of reform, the president's approval ratings will go up, and members of Congress who are wavering will think, all right, well, in 2010, when the midterm elections come around, is the president going to be, popular for having passed health care, or, are we going to be, are we going to have anything to run on? Right. So he's trying to concentrate the mind there.
And trying to get the president's message to work for those members when they go
Right.
back out into where they're from and talk to their constituents. So this August, it's going to play out in these town halls that we've already seen. Some have been quite spirited.
Yeah.
What do you think about those town halls, how those are going to go?
I think the town halls are probably going to be pretty disastrous for the Democrats, and it's not because of any particular quality of the Democratic Party. It's simply if you're the party in power and you're trying to sell something that's very complex, those who are against it are going to get their people out to these meetings much more easily, much more efficiently than your party is. So you're probably going to see a lot of arguing, a lot of those clashes, a lot of angry members saying, why are you trying to take away my health care? Why are you trying to put the government between me and my doctors? Not a lot of good television, I think, is going to come out of this month for the White House, which is why President Obama is going to be out there 2 or 3 times a week across the country trying to create his own headlines.
And the Republicans are saying you're going to put a government bureaucrat between me and my doctor, and the president is essentially saying there's already a bureaucrat there. He's from the insurance company,
Right.
and this is that enemy you've been talking about. The problem, though, with creating that enemy is that the left has something they would prefer more, and that's this public option, the notion of a government option you can use. And the reason they like that is because it hurts the insurance companies.
Right.
So there's a kind of a conflict here, isn't there?
Well, it's kind of a circular argument because the moment you you draw attention to the insurance companies, as you said, people start thinking, all right, what is it about the insurance companies that I don't like? And if you go through a lot of issues, again, they've yielded on a lot of these issues. On guaranteed access, on some form of premium control. No longer are they going to discriminate on the basis of pre-existing conditions. But they do oppose this public option because it would, in the end of the day, be the thing that leads to probably the beginning of the end for private insurers in this country. The problem is that there aren't votes in the House and the Senate for a public option. Votes in the House, but not in the Senate. Mm-hmm. And that means that it's probably not going to show up in a bill. And if it's not going to show up in a bill, you wonder why the Democrats in the White House would be indirectly forcing attention to it. But in part, I don't know if they have a choice. They really have to get the Democratic base more engaged.
They need to get the Democratic base more engaged, and they also need to get people who already have insurance to learn about what's good in this bill.
Right.
They've got some plans for that. Before we get to those plans, did the White House misread the public mood on reform and what people needed to hear to buy reform?
It's a good question. I think if they had the foresight of being able to predict the state of the economy and particularly the size of the deficits, which probably we're going to learn in a couple of weeks are even larger this year than we had assumed, then they might have decided to go a different route. For example, selling or spending their time this year on the insurance protections alone and selling that as a standalone bill so they would have an accomplishment and not trying to do everything at once, which brings in all these questions of how you pay for it and the deficit. I'm not sure if they misread. I think they were ambitious. They tried to lead public opinion on this issue, realizing it's a very complex issue, but I think the economy stymied those efforts.
Right. So now the president's going to focus on the goodies to the extent for people who have insurance.
Right.
The notion is it's not going to change. No one's going to get between you and your doctor, and there are these good things. You're going to be able to take your insurance with you. You're not going to be denied because of a pre-existing condition. So there's going to be more focus on that, isn't there? There's
going to be more focus on that. And in fact, the president is going to frame his arguments under the umbrella of consumer protection, which is a poll-tested phrase. If you notice, it's the same way that he is attempting to sell his major financial reform overhaul to the country under the guise of it protecting consumers from the evil financial interests or from the greedy patchwork of changing all the regulations. So he's going to focus on that, and arguably you could ask, well, why hasn't he focused on that part of it before? And the White House will say, well, he has, but the argument just didn't necessarily crystallize, and there was a benefit to the president's laying out his principles, and Congress in the White House's mind has come very far along. But we'll have to see whether, in retrospect, he should have been selling this early to, people are sympathetic that 47 million people don't have insurance. There are some people who are underinsured who have some insurance but need more. But the mass of Americans that he's talking to are people with insurance who know the system could get better, but they're very afraid of giving something up.
Two quick questions.
Yeah.
Do you get any sense they're going to change their strategy with respect to Congress when they get back, or even now? There's been some debate about whether the president gave up too much leverage by letting Congress work these bills.
Right. I think you're going to see him be more specific, but I still think that they're sticking to this strategy of not wanting to put anything between Congress and the White House, any sort of roadblocks. And I would actually, given that there have been there's progress last week. The Energy and Commerce Committee very narrowly voted out a bill. My sense is they're going to continue that right up until the conference, the House and Senate conference. If you get a bill passed by the House and the Senate, you got to put them all together. At that point, they're going to change their strategy and be very specific.
The last question is, in your conversations with the administration officials, how worried are they that this is slipping away?
I think they are a little bit more sober than they might have been when this debate started, but I do get the sense that they're still fairly optimistic that they're going to get a pretty big health care bill to the president's desk by the end of the year, a bill that's big enough for the president to sign it, to have a huge ceremony, and to have something to run on, or to have something to give Democrats to run on in 2010.
Okay, great. Thanks very much, Marc Ambinder.
Thanks, Sean.
Great reporting. Ending a nearly two-decade-long mystery, the Pentagon announced Sunday they had positively identified the remains of Captain Michael Scott Speicher, the first American casualty of the Persian Gulf War. With us now is Senator Bill Nelson of Florida, who played a key role in pressing the Pentagon to renew a search for Speicher in 2003. Hello, Senator.
Good afternoon to you.
Thank you for being with us. Start, if you would, for me, and just tell me a little bit about Captain Speicher and who he was.
Florida State graduate, Jacksonville, went to high school there, had his family there when he was in this assignment on an aircraft carrier. First night of the Gulf War, he was not scheduled to fly, and another pilot got sick, and so Speicher filled in for him. And on that first night, he was shot down, ejected, and the next morning, in a press conference in the Pentagon, the Secretary of Defense mistakenly declared that he was a casualty. And we did a terrible mistake. We did not go and get a downed pilot. And that, of course, is the big lesson here. Ever since this recognized mistake, whether he was dead or not, we still try to go out and search and rescue. And the military is not going to make that mistake again.
Senator, you've been involved in this for a long time. It's had some ups and downs and missed signals. Can you tell me a little bit about that process, different reports that have come in, even signs of hope that he might have been alive?
Because there was not the search and rescue, and therefore no evidence of whether or not Scott survived, then over the last 18 years you get these conflicting stories. There were some people that would say that they remember transporting a pilot to the hospital. There was an Iraqi refugee here in the U.S. who said that he had had contact with a pilot. All of these turned out to be false. Not necessarily lies, but because there was a pilot, but it was another pilot. And of course, you can imagine the emotional roller coaster that this has been for the family over these 18 years. Right after we invaded in 2003, with the request of the family, I went in there, met with the search team for Speicher. They took me to the Hakamiyah prison, where one of the cells they had found the initials MSS carved into the cell wall. I took a piece of paper and a pencil and I traced that for the family and sent it back, and it was eerily close to the way that he had written his initials.
Senator,
and so all of these turned out to be false leads.
As you've been following the ups and downs of these leads with the family right along with them, have you talked to them since this news, and how are they bearing up?
I talked to Joanne's husband, Buddy Harris, yesterday, and it's a sad day, but it's a sobering day, and in a way it's a relief. But of course the family still has a lot of questions. And I've been on the phone today with the chairman of the Joint Chiefs and the Chief of Naval Operations, asking them, once they get through the classifications, to get over there to the family and give them a complete brief with all the forensic evidence, because the family needs to put a lot of those lingering doubts to rest.
What are some of those lingering doubts, Senator?
Well, for example, was he alive? Mm-hmm. How did he die? Was he dead when the Bedouins arrived? And by the way, that with all these false leads over the last years, we knew that the likelihood was that we were going to find the evidence exactly how it was. And that was these Bedouin tribes roam the desert. So you had to find the particular Bedouins that were there at the time of the crash. And sure enough, that's how they found the remains.
Okay. Senator Nelson, thank you very much for joining us and sharing this story with us.
Thanks.
Thanks for watching Washington Unplugged. Join us again tomorrow at 12:30 on CBSNews.com. I'm John Dickerson.